Hello, my name is Nicola Smart from the University of Oxford. I'm one of the scientists of tomorrow and I'm here at the ESC Congress. With me today is Sarah Costantino from the Karolinska Institute, and Sarah was the winner of the Young Investigator Award in Basic Science. Welcome, Sarah, and thank you, many congratulations on your achievement. I'd like to ask you about your study, and perhaps if you could just outline what the rationale was behind the study that you performed.
In diabetes, hyperglycemia and insulin resistance contribute to increase oxidative stress burden, which increase myocardial damage. However, normalization of hyperglycemia is not able to rescue cardiovascular risk factor in diabetic patients. And this is true because several clinical studies have shown this phenomenon. Among a lot of factors involved in this phenomenon, oxidative stress may play a major role in this setting. Based on this background, we focus on the role of P66. P66 is a mitochondrial adapter that is involved in the response to oxidative stress. And for our study, we investigate the role of P66 in the persistence of hyperglycemic memory despite normalization of hyperglycemia.
And so you carried out a study to look at microRNAs that were dysregulated in the diabetic patients, and from that you focused on two in particular, miR-218 and miR-34A. What was the rationale for choosing those ones in particular?
In our study in mice treated with streptozotocin, we saw that P66 is persistent and upregulated despite normalization of hyperglycemia. For this reason, we want to investigate the mechanism underlying this phenomenon. And we saw that two epigenetic chromatin modifying agents, SIRT1 and DNMT3B, are involved in this phenomenon. For this reason, we identified these two chromatin modifying agents with a macroarray. For this reason, by in silico prediction, we identified the two microRNA that are involved that target specifically these two chromatin modifying agents. Specifically, SIRT1 was targeted from miR-34A, and the DNMT3B is targeted by miR-218. And we looked at these two microRNA and we saw that these two microRNA are persistent, upregulated. So this is the reason because we focus on these two microRNA.
So you performed a very elegant study in mice. Can I now ask how you see this translating to the human diabetic population?
At the moment we don't have a study in diabetic patients, but we have to enroll some patients. It's good with the microRNA that they can be a biomarker, so we can identify these microRNA also in the plasma of patients and not only in the tissue. And it's good because it's not really feasible have a biopsy from cardiac tissue in patients. And there are also many preclinical and phase 1 clinical studies that show that microRNA can be targeted in humans, so with the antagomer or with the mimics. In our case, we have this upregulation of these microRNA, so we need some mimics that specifically target and maybe can rescue cardiac phenotype.
Indeed, so it could be very useful as a biomarker, but also an important potential target to treat those patients that don't respond to glycemic regulation.
It's what we want to
It's fantastic.
investigate.
It's a wonderful study, and thank you for sharing it with us today, Sarah.
Thank you very much.